A patient today asked whether, when they had a dental procedure, they could take opiates like Percocet or Vicodin or oxycodone when they were seeing me for opiate use disorder and were taking buprenorphine to manage that opiate use disorder. This is a really great question, and it's a very important question. And the answer that I give to patients is going to be different for each individual patient. And the plan may be very different for each individual patient based on where they are in recovery, what procedure they're having, what their support network is like, and many other factors. And the truth is that I do have a concern that many individuals assume that if they have a surgical procedure or if they have a dental procedure, that they have to take opiates. And if they don't, they're going to have excruciating pain. That's actually not the case. And I've had patients with a history of opiate use disorder go through dental procedures and go through significant surgeries without opiate medications and do quite well. Obviously, that those individuals may have a little bit of more pain after those procedures than most individuals, but by doing so, by avoiding opiates, they were able to really decrease their risk of relapse. What's very important in these cases is that the provider that's prescribing the buprenorphine or who's managing them for their opiate use disorder is in close collaboration with their provider who's doing the dental procedure or who is performing that operation. At least there's some discussion about what the plan's going to be. You want everyone to be on the same page, and you want to form a specific plan in terms of what medications you might use. So an example of this, someone might actually use their own buprenorphine for their opiate use disorder to provide some pain relief, because those are partial opiate agonists and can help with pain if used for pain. You may also want to utilize medications like Tylenol or ibuprofen, being sure to stagger those medications and to be careful that you're not prescribing too much that could result in liver failure from the Tylenol or increased risk for stomach irritation or ulcers, etc., from the ibuprofen or the other anti-inflammatories that you use. And sometimes providers will use medications like gabapentin, which is a medication that treats peripheral neuropathy and is often used off-label for other indications and may be safer than using opiates. But there are other medications that you can use too. And the bottom line is that if providers speak before the procedure and providers speak with the patient and likely also incorporate family and friends, individuals can often do very well getting all kinds of different surgical procedures without the use of opiates, and do surprisingly well and surprisingly limit the amount of pain that they have afterwards. And it can be done in a humane way, and it can be done in a way that can really limit risk for relapse on opiates. If you believe this video pertains to you in any way, please be sure to reach out to a medical professional and a mental health professional directly. This is not a one-size-fits-all model, to say the least. And there are some times where you may recommend short-term use of medications for pain that are traditional pain medications, but it's a very complex topic, and you really want to be thoughtful about limiting a person's risk for relapse on opiates when they have a history of an opiate use disorder.